Welcome all to this platform. This is a series of knowledge upgradation session. Today, the second day from Dr. Love K Katarria. He is dealing with the physiology of chi, essence, blood, body fluids. This is very much useful for all the acupuncture therapists. Dr. Love K Katarria is basically an allopath and he loves acupuncture so he changed his profession from allopathy doctor to the acupuncturist. We can hear more from him. Welcome, doctor. Now you can take care of. Thank you.
Thank you, ma'am, for the introduction, and I welcome all of you on the second day of this session. And we'll have a small recap first. So yesterday we studied about all these vital substances, the chi and essence, the two of them. And we saw there are three types of essences: pre-heaven, post-heaven, and kidney essence, their functions, and why they are so much important. Then we saw about various types of chi: gathering chi, food chi, central chi, upright chi. And today we'll be starting with the functions. Okay, so I'm sharing my screen now. So these are the functions of chi. So we'll go one by one. So the first function is transforming. So transforming means that the chi has a function of transforming one thing into the other. For example, food chi is getting into transformed to gathering chi, or food chi is getting transformed into blood, or food is getting transformed into food chi itself in the presence of original chi. Okay, so chi is important for the transformation of anything. Okay, suppose kidney chi is required for the transformation of body fluids into urine. Okay, then let's see transporting. So transporting, along with the transforming function, transportation is also very much required. Like food chi is getting transported up to the chest, or the lung chi is transporting the defensive chi and the body fluids, or you can say the sweat. The kidney chi, the lung chi is also transporting the chi to kidneys, and there are few of the examples I have shared. So we'll be going one by one. This is a diagram to explain these functions. So for transformation to happen, you need something, you need some yang energy, and chi is yang in relation to blood and body fluids. So this chi, for example, spleen chi transforms food into food chi, and kidney chi transforms fluid, and bladder chi transforms into urine, transforms urine. It's further, there is a when we'll study body fluids, there is a series of processes happening. So we'll be taking that topic under. So heart chi transforms food chi into blood. Okay, food chi is getting converted into blood in the heart, and lung chi assists it. So yesterday I explained about how the gathering chi is helping the heart and the lungs in their normal functions. So similarly, today we'll be seeing that food chi is getting transformed into blood, and according to Ayurveda, we also know that as per Ayurveda, that food is the ultimate source of the formation of blood. So that theory is similarly applied here as well. So transporting. So in the process of transformation of various substances, chi transports them in and out of various structures. So now transporting is to deal with, like, chi has to move, chi has to transport something. So transporting deals with the movement. So whether the chi will be going up or down. So up is like ascending and descending and in and out. So that is entering and exiting. So these four mechanisms of ascending, descending, entering and exiting comes under the chi mechanism, and we'll be dealing it later today. So there are some examples. The spleen chi transports food chi to the chest. The lung chi transport fluids to the skin and diffuses defensive chi into the space between skin and muscles. And this is how the sweating is happening. The defensive chi is playing. How defensive chi is linked to lung chi. And lung chi is definitely important. If it is strong enough, defensive chi will be circulating. Otherwise, the patient will be very much prone to colds. Now, kidney chi transport chi both upwards, so upwards to the lungs, okay, and downwards to the bladder for the transformation and excretion of fluids. So liver chi transports chi in all the direction. It is the property of liver chi that it transports the chi in all direction and assists the other chi so that they flow normally in their direction. Okay. And the lung chi definitely transport the chi downwards towards the kidneys. Now, what the holding function of chi? The holding means to hold the blood and the body fluids at their own place. And this is done by mainly spleen. Okay, so spleen is responsible for it mainly. And if spleen is weak, you must have seen those patients at a slight, if you hit them slightly, the bruise will happen. So the bruise is mainly due to the blood, the chi is not able to hold the blood in the blood vessel. So that is the reason, due to a deficiency of the spleen chi, the blood is leaking out even after a very short snap. So the examples are spleen chi holds the blood in the blood vessel and the fluids in their proper spaces. And kidney chi is responsible for keeping the blood in the uterus. So in case of menorrhagia, so menorrhagia is a medical term which implies excess of menstruation or heavy bleeding during periods. So those patients having a deficiency kind of cause, okay, so there are two causes. Always in a disease there could be two causes. Either it could be due to deficiency or it could be due to the excess. So excess has some other reasons, and as far as deficiency is concerned, so it is mainly due to deficient kidney and spleen, which is the main reason for heavy bleeding. Okay, I'm not saying it is the only reason. So it is the reason for the deficiency, not the excess. Okay, so kidney chi and bladder chi, they hold the urine. Those patients or those children who are unable to hold the urine, we just need to tonify the kidneys, and you will see that as the kidney improves, the energy improves, the patient will be able to hold the urine in a better way. I'm not talking in terms of those patients having their nerve impingement, like what happens in the back pain, L4, L5, S1. Definitely the kidneys are weak, but you need some other treatments as well. So raising is the another important function. So holding and raising, they go hand by hand. So chi ensures that body structures are held in their proper places. Spleen is responsible for this. Basically, spleen has the tendency to raise the chi upwards. Okay, so food chi always goes up. So it is the spleen. So that energy is also responsible for holding the structures in their proper place so that no prolapses occurs. If the spleen chi is deficient, the prolapse can happen. Various prolapses, the hernia is one of them. Okay, or uterine prolapse could be the reason, but that is a deficiency. So severe deficiency of spleen chi has led to the prolapse or sinking of the chi has happened. Kidney chi raises the uterus and spleen chi raises the organs in general. GV20 is a very good point to raise the chi in case of prolapses. So raising by chi refers also to raising of body fluids and blood, and this function of course closely linked to the previous one, that is the holding by chi. Again, spleen is responsible there as well, kidney is responsible there as well. So that definitely in pathological conditions characterized by chronic leakage of mucus or blood, like in case of Menorrhagia or Menorrhagia. So it is not the only the holding function has fault, but also the raising function. So leukorrhea is like the white discharge. It should not happen. It is the like the essence is coming out of the female body, and it is something which needs to be preserved. So it has various causes why leukorrhea can happen, but if it is due to a deficient cause, it could be due
Doctor,
to deficiency.
excuse me.
Yeah.
Your camera is moving. Your picture is shaking.
Okay, I'll check it.
Okay. It is not stable.
I try.
I think now it is okay.
Okay.
No. Again.
Okay. Check kar raha hai.
Yeah. Is there any backdrop? No. Your whole thing is moving.
Actually, it's shaking. I think due to the fan. I think now it will be fine. Is it fine now?
Again, some shaking is there.
Yeah. Now is it fine?
Now it's okay. Okay, doctor.
So moving ahead, now the protecting function of the defensive chi. We already saw yesterday that defensive chi has a protecting function from the external pathogenic factors. So defensive chi along with kidney essence and nutritive chi, they are all responsible to create the immunity which we need. Okay, so the strength of defensive chi is the space determines our resistance to external pathogenic factors such as wind, cold, and dampness. So again, these three factors are responsible: the defensive chi, nutritive chi, and the kidney essence. These three are the three factors for your immunity. The warming. We saw yesterday that defensive chi also has the warming function, as it provides the necessary warmth. Along with that, kidney yang, as it's the original yang, origin of all the yang energy. So kidney yang is definitely responsible. That is the fire of gate of life. You can say kidney yang. Along with that, spleen yang is also involved in maintaining all the kind of physiological process or the warmth needed. So you can typically see in the patient having deficiency of kidney yang and spleen yang, they feel cold. Okay, this is one of their symptoms. Or their feet and hands must be cold. So what you need to do, you put some moxa at GV4 or 2B23 point, and do some moxa for time, and you'll see that over a period of time, as the kidney tonifies, so this will the coldness, the warmth will increase. Okay, and similarly, if it is a case of spleen yang deficiency, you need to tonify for the points for spleen yang, and you need to tonify them, and the warmth will increase. I've already explained the source of yang and warmth in the body is primarily kidney yang and the minister of fire. Spleen yang also warms the body, but it in turn derives the warmth primarily from kidney yang, and that is why even in case of deficiency of spleen yang, you need to tonify kidney yang as well, because ultimately kidney yang is derived from the spleen yang is derived from kidney yang. Okay, so this is the mother of it, so you need to tonify the mother first. So now this is a very, very important part. We have seen the functions although, but in order to perform those functions properly and normally to maintain the physiological processes, the chi movement and its direction. First of all, the chi, there are two factors. The chi should move. Okay, it should not stop. This is the first factor. The other is it should move in their normal direction, not in the pathological direction. The normal direction, what is their flow? So this will keep the body in the balance. So again, this is the chi mechanism what we are talking about. The ascending, like we saw, kidney chi ascends, and spleen chi also ascends. The spleen chi ascends to the chest. The kidney chi ascends to the lungs. So in case if the spleen chi goes down, okay, if it is going against their direction, if it's not ascending, it started descending. So that will lead to some kind of pathology, some kind of disease, and some symptoms will be seen. This complex of ascending, descending, entering, and exiting of chi is called chi mechanism. So chi mechanism indicates the flow of chi in all the organs of the body, all triple burner cavities, joints, skin, muscles, diaphragm, fat tissues, and membranes. So all in all, everywhere, okay, everywhere chi is moving, and it should move in their normal direction. If it start moving in the opposite direction, or it just stops in some cavities or in the joints, there will be pain, swelling, and some symptoms will appear. So the chi mechanism is like a vast system of roads and motorways where the traffic needs to be regulated by. So the smooth movement of chi in the chi mechanism relies on the proper ascending and descending of chi to various organs and structures, and also on entering and exiting of chi in and out of various structures. So you can see again why it is happening. It is happening in order to maintain the balance between yin and yang. So ascending and exiting is yang, okay, and descending and entering is yin. So it again it is there to maintain the yin and yang balance in the body. If that is maintained, the body is in balance. If that is not maintained, the body is out of balance, and accordingly the symptoms will appear. So excess of yang will simply imply excessive ascending and exiting of chi, while an excess of yin will imply excessive descending and entry of chi. So let's take an example here. So excessive ascending can happen in case of liver yang rising. Okay, that leads to headaches, migraines, even paralysis, or the paralytic episodes can happen. Okay, and excess of descending can happen in case let's take example of spleen chi unable to ascend, so it start descending. There will be loose stools. The spleen is not able to hold the food chi. So in case of spleen chi deficiency, medically you can see it correlated that food chi is not going up, it's going down, it's going out of the body. So all the nutrients which were there to get absorbed by the body are going out in the stools. So if someone having loose stools or semi stools, I'm not saying all of them, but mostly, as far as my experience is concerned, they are dealing with spleen chi deficiency in most of the cases, not all. And in long run, it will lead to deficiency of various kinds of minerals, vitamins, and nutrients. Only and only because food chi is not going up, it's going out of your body. So when the chi mechanism is disrupted, there will be chi stagnation or chi rebellious. So chi rebellious is simply means that chi is not going in its normal direction, it's going just opposite to it. So this is the diagram explaining it. Now let's take each organ one by one. So lung chi has the nature of first of all, yesterday I explained about the respiratory mechanism, the relationship between the lungs and the kidneys, how they constitute a cycle of inhalation and exhalation. So lungs chi send the chi downwards to kidneys and bladder. So if it is going properly and kidneys are able to hold it, the respiration will be normal. Otherwise, there will be shortness of breath, breathlessness, or cough. In case the chi also, the lung chi also goes downwards towards the urinary bladder, and that is also responsible for the discharge of urine. So in some cases, especially in old age, the lungs get weak. So there could be the episodes of urinary retention. I'm saying this is not a very major cause, but mostly in cases of elderly patients, you will see that they're able to hold the urine, or it's simply because of the deficient lungs. You need to modify it, and you'll see that the urine just start coming out. So the same thing happens in cases of elderly patients with the constipation is concerned, because lungs are weakened. So lung chi is required to move the stools out of the intestine. So that is deficient in that age. It doesn't happen usually in the younger age, mostly in the elderly patients. Then the lungs are also responsible for diffusing the defensive chi to the bit under the skin, that is between the skin and the muscles, and they're also responsible for moving the body fluids out of the body, like sweat. So it also descends to diffuse defensive chi and sweat to the space between skin and muscles. So lungs also regulate the entry and exiting of chi in and out of the space between skin and muscles. The entry and exiting of the chi in and out of this space regulates defensive chi and sweat, and therefore also influences our resistance to external pathogenic factor. So suppose if chi exits too much, okay, so this is what we discussed yesterday. There will be too much, the space will be open too much, and there will be too much of sweating also, because lungs are weak and then they are unable to hold the body fluids, and sweating is happening too much. Okay, so if it is closed too much, so that happens in case of when some external pathogenic factor enters this particular space and prevents the defensive chi from its functioning. So that will lead to a higher fever. High fever will happen. Okay, in that case, we need to promote sweating, and we need to take the external, we need to expel the external pathogenic factor. And that the treatment always depends on what pathogenic factor has entered. So liver. Now we come to liver. So liver, it is a wind energy. It is wood. So wood expands in all the directions. So similarly, liver, it expands the chi just flow in all the directions. And a very, very important physiological function is that it also assists in the free flow of chi of the other organs as well. Suppose, let me give an example. that normally the stomach chi should go down and spleen chi should go up. That is a physiological process. But in case of in pathology, what will happen? Uh, the the liver, there is a condition like liver attacking stomach or liver attacking spleen. So what will happen in such cases? That liver will attack the free flow of stomach. So stomach chi should go down. Instead of going down, it will start going up, and you have the symptoms like nausea, vomiting, uh, burping, something like that. Okay, and so liver is basically responsible for assisting the other organs chi. Okay, so it also helps the chi of intestine and bladder to descend. So you should not deal any. The liver chi should not go like angry. Okay, you should be happy with the liver. Otherwise, you like behave like a gunda and will attack each and every organ. Especially the example which I quoted, it can happen in case of emotional stress. So normal ascending of liver chi is coordinated with the descending of lung chi. So as far as lung and liver are concerned, so lung chi goes down and liver chi goes up. This is the way how they maintain balance as far as metal and wood are concerned. Coming to the kidneys, kidneys has as we saw that the kidney take the vapors from below to from the kidneys to lungs. Okay, and that goes out as a sweat. Okay, so and the descending function of the kidney chi is that it helps in the transformation of body fluids into urine. So it also helps in the descending the urination process also. Okay, so it helps the urinary bladder also to move the urine out of the body. I've already explained this in diagram. That I hope you remember, the lungs control the exhalation and the kidney control.
Excuse me, doctor.
Inhalation.
There is some disturbance in the voice, something like wind blowing or something like that. Is it maybe because of the fan or your mic? We can't understand, but something is there.
Still there, Abhi?
Yes, when you talk long, we can feel it like that.
Okay, I'll. What's happening this time? Okay, I'll if there is some interruption again, just let me know.
Oh, sure.
I'll check it again.
Yeah.
Okay. Okay, so let's proceed further. So stomach and spleen. So as I told you, the spleen, the spleen chi always goes up, and the stomach chi goes down. Okay. Sorry, spleen chi. Spleen chi go up, and stomach chi goes down. And stomach is responsible for rotting and ripening of the food, and spleen is responsible for converting the food into food chi and taking that food chi to the chest. Definitely, as the stomach and spleen, they are earth element, they are related to muscles. So a good spleen chi is also responsible for their entering and exiting into the muscles, and in a simple language you can understand that it is responsible for the health of the muscles. So heart and kidney axis is a very, very important part as far as the hormonal problems are concerned, especially in females. Not only in females, but especially in females. So the kidney and heart axis is like the heart fire goes down to the kidneys, and the kidneys water, the coolness of kidneys water goes to upwards ascends to the chest. And if that does not happen, there will be episodes of restlessness, depression, anxiety, and various kinds of other hormonal imbalances. So thus the normal physiologic functioning of the organs depends on the correct direction of chi flow. A derangement of these different directions can cause various problems. Now, these arise when the movement of chi is impeded or when the direction of movement is opposite to what it should be. Okay, so I have already explained, so I hope it's pretty clear by the time. So pathology of chi. Now, till now what we saw was the physiological process, the normal process. Now we'll be looking at the pathology. So as I told there, mainly the chi should always be moving, first of all, and it should flow in their normal direction. So accordingly, there are 4 different kinds of pathology. So either the chi could be deficient. So if it is too deficient, it will stop. It won't have the energy to proceed further. Then if it is too low, if it is too deficient, the chi will be sinking. It will just start sinking. The prolapses will happen. Then the chi is stagnant, the flow is not happening, and the other is the chi rebellious, the chi is going against the direction. So if chi is deficient, how it can be deficient? We yesterday discussed. It could be due to overwork or poor diets or dietary irregularity, and mainly stomach, spleen, lungs, and kidneys chis are prone to being deficient. So the chi sinking, this happens mainly in case of spleen and kidney. Okay, there will be the prolapse. In case of stagnation, so liver chi is the one the most frequently which get stagnated, along with lungs and intestine as well. So rebellious is again, I already discussed this part. Now we are moving to the next very important part. The vital substance is blood. Okay, so blood is it's itself according to blood, which we are talking in terms of acupuncture or Chinese medicine, is a bit different concept than what we already know. We know CBC, RBC, CBC complete blood count, and there is a whole lot of cells are there. We know there is plasma. There are 2 parts. In a short, I'll be explaining the medical part. So blood is composed of 2 parts. One is the blood cells, blood corpuscles, and the other is the liquid part that is known as plasma. So plasma has a lot of proteins in them. Okay, now the cells have, there are mainly 3 types of cells. They are red blood cells, white blood cells, and platelets. Red blood cells are responsible for carrying the oxygen. Okay, and the white blood cells are responsible for our immunity. The platelets are responsible for the coagulation to happen. So this is according to the modern medicine. But as far as the acupuncture is concerned, blood is itself is a form of chi, but it's a very dense form of chi. So as I told you yesterday, that chi is inseparable from blood, and without chi, blood is not blood. Okay, it's dead blood. So easily, how we can understand this thing, that if there is oxygenated blood, the blood will keep on moving. If there is less oxygen in the blood, or deoxygenated blood is more, and you are in a stressful condition, that happens during that time. So if the deoxygenated part is more, or that will lead to slow blood circulation, and finally leads to blood stagnation. So those who know bloodletting, or who have done bloodletting, they could see that in the areas where we do bloodletting, So in areas of blood stasis, what happens is there is a very dark color blood coming out. Dark color blood is a dead blood. So as soon as we remove that dead blood, the symptom starts decreasing. The patient starts feeling good. The disease takes a U-turn. Okay. So the blood is all about movement. The blood should move. There should be chi in it. So source of blood is, see, blood is formed from food, definitely. And it is formed from kidneys also. There's a kidneys has a very, very important role. And as far as the modern medicine is concerned, so it has been proved that a hormone is released by the kidneys, which goes, the hormone acts in the bone marrow from where the blood cell production takes place. So see, so much years back in acupuncture, people already discovered that the kidney is responsible. So the pre-heaven chi and the post-heaven chi, that is the spleen and stomach and the kidneys, both are responsible for the production of blood. See, alone kidneys can't do. If you don't eat food, the blood production will go down. So that is where the importance of stomach and spleen chi is there. And in some cases, like aplastic anemia, is a condition where there is no production of cells are there, blood cells doesn't form. So in those cases, it's a very dangerous situation, life-threatening condition it could be. So in those cases, we can clearly see the bone marrow is unable to produce cells. So that is mainly due to deficiency of kidneys. So, and this is how we can see that how it is important. Then heart also has a role to play, because the food chi converts into blood in heart. Okay, the formation of blood happens in heart. So heart, we are unable to prove it medically still in modern medicine, but I'm sure somehow or the later part will be able to prove it. So, but it's according to acupuncture that blood is formed in heart itself, and heart governs the blood. So this is a simple diagram to show that how the blood formation happens, and that happens in the presence of original chi in the heart, where food gets converted into blood. So yesterday I told that spleen takes the food chi up to the lungs, and the lungs pushes that food chi to the heart. So when it goes into heart, original chi act as a catalyst, and that leads to the formation of blood. So kidney stores essence which produces marrow, and this in turn generates bone marrow, which contributes to making blood. So I have already explained these points that pre-heaven and post-heaven chi are responsible for the formation of blood. Another diagram to show. So what are the functions of blood? See, the very first is, and the most important function, and you all are aware that it helps us to provide nourishment to the body. Okay, so medically we can see that the blood carries all the kinds of proteins, glucose, and all those things from the intestine, and from the intestine it goes to the heart. Heart pumps it, and from there it goes to each and every cell. And where the oxygenation, in the presence of oxygen, the the glucose get the burns out, and the production of energy happens. So if there is no production of energy, no nourishment will happen. So blood has a very, very important role of nourishing the body and the tissues. The other is the moistening function. So you can typically see in cases of severe anemia, the skin will look very dull. In case of liver blood deficiency or liver yin deficiency, there is a very peculiar symptom of dry eye. So wherever there is some deficiency of blood, the dryness will be happening. Okay, there will be some dryness. So blood has this the moistening function too. So, for example, liver blood has the function of moistening the eyes and the sinews, that is the tendons. Okay, so if the liver blood is in sufficient amount, the eyes will be able to see properly, and the sinews, that is the tendons, will be soft, and they'll be able to they're very flexible. Okay, so in case of very tight tendons are there, you have to treat the liver, clear, because the the nourishing function, the moistening function of blood is not available due to the deficient blood, the deficient liver blood in particular, that the sinews are not getting enough nourishment. So the liver blood also moistens the skin and hair, ensuring the skin is not too dry and the hair remains shiny and healthy. So all of you who want to keep your skin glowing, please take care of your liver blood. Heart blood moistens the tongue, and heart blood also has the role in keeping the mind calm and in control. Otherwise, see, blood is yin and mind is very rarefied, so it is yang in compared to blood. And blood has the anchoring function of mind in the night. As for just try to understand this concept. See what happens, the chi, the mind is yang. So yang will remain in control if there is enough amount of yin, that is blood available, especially the liver, heart blood, because heart is related to mind. So if there is sufficient amount of heart blood, the mind will anchor into the blood and you will be able to sleep a very sound sleep without dreams and very peaceful sleep. But if there is some deficiency of heart blood, so the yin is deficient, the yang will float. So the mind will float and wander, and that the symptoms like anxiety or restlessness or dreams and something like कि मेरा mind चलता रहता है सोते वक्त भी, those kinds of symptoms will be there. So mind will be unhappy and uneasy. So this is typically manifested by deficient restlessness characterized by vague anxiety, slight irritability, and a feeling of dissatisfaction. When someone is asleep at night, blood naturally impresses the mind and the ethereal soul. Ethereal soul is the subtle part of liver which is present affecting the mind. That is a different topic. But if blood is deficient, the mind and the ethereal soul float and the person cannot sleep or dreams a lot. So in order to nourish blood, we use CV4, ST36, liver 8 and SP6. We need to tonify them. So now every organ like heart, spleen and liver, and they are related to blood. See, the production of liver, production of blood takes place by spleen. So spleen is the producer of blood, the food chi getting converted into blood. So liver has the property of storing the blood. So liver is, if you have seen the anatomy of liver, just go Google it, and you will see that it is like a sponge. Okay, so it has spaces, very small spaces known as sinusoids in liver, and it has a function of storing the blood. So the better the sponge, the better the liver. Okay, the better the functions of liver. Okay, so liver stores blood. I'll explain this concept. See, whenever you are doing some work or you are standing or not at rest, the blood from the liver moves out into general circulation. But when you comes to rest, that excess blood moves back again to the liver sinusoids. So this is how liver stores the blood, and it is that blood which has a very important function in nourishing the eyes, the sinews, the menstrual function, and in holding that ethereal soul. Okay, so we'll go one by one. First of all, we'll see heart. That heart governs the blood and blood vessels, which are responsible for its circulation. So as a heart is fire and fire is yang, and it transforms into yin, that is blood. So blood has a like a tendency to cool down the fire and prevent it from flaring up excessively. So if you want to check the condition of pulse as far as Chinese pulse diagnosis is concerned, so you need to check the front position, and the left one is concerned with the heart, the right front position is concerned with the lungs. So the front position on the left side will tell you the condition about blood because related to heart, and the left one, as it is related to lungs, will tell you the condition about the chi. Okay, so this is you can find out. Now spleen. So as you know, the spleen is the place from where the origin of food chi happens. Food chi is happening, and then it's leading to the formation of blood in heart. The spleen chi ensures that blood remains in the blood vessels and does not comes out of it. So if the spleen chi is deficient, chi cannot hold the blood, and hemorrhages may result. Hemorrhages can also result due to excess of heat. So that heat is like excess heat is like the excess cause, and the spleen chi deficiency is the deficiency cause. You have to, there will be the difference in the symptoms in both the cases. You have to figure it out what is the cause. Now, as far as liver is concerned, as I told, the liver stores the blood, and this has several important meanings. That is, from the physiological point of view, when a person is erect and engaged in normal everyday movement, blood flows to the muscles and sinews. When a person lies down, the blood flows back to liver. So when lying down, the blood regenerates itself in the liver. Hence the importance of having adequate rest, especially lying down in case of deficient liver blood. See, there is a very important thing, and these days what we are doing, we are not going according to nature. Most of the patients which I see, that they just especially the young adults, teenagers, what happens is they sleep very late. Okay, and they wake up very early, very late as well. So waking up early has different effects, and sleeping late. So as far as acupuncture is concerned, if you are sleeping late, so what happens is liver is unable to take a rest. Okay, so in long run there will be some liver blood deficiency, because regeneration, most of the repair work happens during the night when you sleep, and if you don't go to sleep at the right time, there will be the liver will be disturbed, its function will be disturbed, which will lead to, in long run, liver blood deficiency and heart blood deficiency. And this is a very common problem we see across teenagers or the young adults. And they have a typical complaint that, sir, I want to sleep, but it takes a lot of time for me to get to sleep. This is a typical symptom. Either there is a heart blood deficiency or liver blood deficiency. You have to figure it out. There are points for it. Just apply them, and then you will see the difference. Then the second, the blood stored in the liver has a function of moistening the eyes, which promotes good sight, and moistening of sinews, which promotes flexibility of joints. So all those patients with the very tight tendons, very stiff back, very stiff body, very stiff legs or knees, you need to work on the liver blood. The more it will move, the more it will be better, the more soft the sinews will be. You can also use, for the eye problems, definitely it's important. So those patients having floaters, I hope you know that floaters are like the black spots moving in front of your eyes, very annoying. So that is another symptom of liver blood deficiency. And the very important part, the important function of liver blood storage is this liver blood is the only responsible for the menstrual blood during the periods, which is assisted by the penetrating vessel. See, you all know there are the 12 channels in the body. Okay, apart from those 12 channels, there are 8 extraordinary vessels as well, and penetrating vessel is one of them. So penetrating vessel is known as, it has various functions. I'm not going deep into it. The whole seminar is required to explain it. But in short, penetrating vessel is also known as sea of blood, and it has a very, very important role in all the female gynecological processes. So as you know, it is a sea of blood. It is responsible for taking the liver blood to the uterus. But again, if the liver blood itself is deficient, the penetrating vessel will also be empty. And it is this blood which is responsible for periods to happen. So thus the liver blood is extremely important for regular and healthy menstrual function. So kidneys and liver have a common origin. The kidney stores essence and liver stores blood. And this you must know that kidneys and liver have a common origin. Then kidneys are the mother of liver, you all know. And so essence and blood, they mutually influence each other. How they influence? See, essence gets converted into blood. Okay, and blood is again trying to nourish and replenish the essence in a long run. Yeah. The kidney essence controls the reproductive function. We have seen that yesterday, how kidney essence is responsible for reproductive functions. And similarly, blood is also influencing the reproductive function in women. So the reason this is more relevant in women than in men, because women's physiology is more dependent on blood, and men's physiology is more dependent on chi. Okay, so what we are trying to say is essence and blood, as we discussed yesterday, that all the vital substances, they get transformed into each other. So ultimately, all are the forms of chi, each one having its different function, and as when required, they get transformed into each other. For this reason, it is said that kidney and liver have a common origin, and state of liver blood is extremely important. So if liver blood is deficient, this can lead to amenorrhea or scanty periods. Stagnant liver blood can also cause painful periods. Stagnant liver blood can also cause fibroids. It can also cause nodes, breast nodes. It can, I'm not saying fibroids are only due to liver blood stagnation, but it could be the cause. Phlegm is another cause. So here's another diagram. So now let's see how lungs is affecting the blood. So lungs has the effect, is the function of pushing the food chi to the heart, so that there the the transformation of food chi into blood can happen. And as we all know, the lung control all the channels and blood vessels. It means that the lung infuse chi into the blood vessels to assist the pushing action of heart. See, I explained you yesterday that lungs ultimately has the function of the basic function is to take the air in, the pure air in, the pure chi in, and take the impure chi out, that is carbon dioxide out. So when the blood is getting oxygenated, it becomes lighter, and which becomes very easy for heart to push the blood. The more oxygen is there in the blood, the more lighter it is, and the easier it is for the heart to pump the blood. And that is why we have seen that in cases of lung diseases, there sometimes those people prone to heart diseases, the heart attacks can develop. Now we see kidneys. So kidneys contribute to the production of blood in two ways. So one is that food chi is getting converted into blood in the presence of original chi or kidney essence. So this is one, and the implication of this in clinical practice is that in order to nourish blood, we need to tonify spleen and kidneys. Now we see there is this is a very important relationship between blood and chi, and why we are discussing it so much. Blood and chi relationship, and stressing it again and again, because in clinical practically we'll see these things in our clinics. So blood is a form of chi, a very dense one, but chi is yang in compared with blood. Blood is yin if compared with chi, but chi will become yin if we compare it with mind, because mind is the subtlest form of chi. So chi and blood are inseparable. Nutritive chi circulates with blood in the blood vessels, and it is this chi which we utilize for doing acupuncture, suture, etc. So the close relationship between blood and chi can be observed in the clinical science. Yes, this is a very important part. See how we can see that. So suppose there is an excessive blood loss, hemorrhages happen. So the person will, after getting the blood loss, the symptoms will be, the person can develop the signs of chi deficiency, okay, like sweating, breathlessness, and cold limbs after a heavy blood loss. On the contrary, if there is too much of sweating has happened, that is too much loss of chi is there will be signs of blood deficiency. Okay, blood deficiency will be there. Now the blood, later on we will also see that body fluids are also getting converted into blood, and blood gets converted into body fluids. So everything is getting converted into each another. So if too much of blood loss, if too much of body fluid loss is there, as what happens in case of heavy sweating, so there will be signs of blood deficiency as well. So chi is also deficient. Blood. What I'm trying to say is each and every vital substance is affected if the other one is affected. It's not like everything is separate. So this diagram shows that chi generates the blood. We have seen the original chi and the food chi generated the blood. Chi moves the blood. See, the gathering chi or the lung chi moves the blood, and the chi holds the blood. The spleen chi holds the blood in the blood vessels, and the blood is the mother of chi. So chi generates the blood. How? And we have seen this, that blood chi generates the blood insofar as food chi is the basis of blood, and the lung chi is essential for the production of blood. Because if chi is deficient, blood will eventually also be deficient. In practice, if it is often necessary to tonify chi in order to nourish the blood. Okay, so they go hand in hand. So chi moves the blood, and without chi, blood won't be able to move, and it will be an inert substance. So nutritive chi flows with the blood. Lung chi infuses the necessary chi into the blood vessel, and if chi is deficient or stagnant, it cannot push the blood, which will also stagnate. So always remember, in early stages there will be chi stagnation, and in very chronic cases there will be blood stagnation. First chi will stagnate, and then and if this process continues in a longer run, this will lead to stagnation of blood. So that is why we say that we need to do some deep breathing and pranayama to how stress is getting relieved by taking deep breath or doing pranayama. Why it is said, this is the only reason, because it will keep on pushing the blood, the stress or the anxiety. What does it do? It simply stagnates the chi. Okay, so if it's getting stagnated, in longer run, blood will also get stagnated. So there will be poor supply of the blood to the brain and to the various other parts of the body. There will be slow circulation. So in order to improve the circulation, we need to take more and more of oxygen so that it remains lighter. The circulation improves. Chi holds the blood. We have seen that chi holds the blood in the blood vessel, thus preventing hemorrhages. This function belongs primarily to the spleen, and in case of uterus, it belongs to kidneys. So if spleen is deficient, chi cannot hold the blood, and there will be hemorrhages. However, kidney chi also plays an important role. Blood nourishes chi. This is very important, because how it is doing that, it relies on chi. Chi relies on blood for the nourishment. So as you know that, see, if there is a deficiency of blood, okay, so the organs, all the vital organs or the important organs or the body, the body as a whole, they'll lack nourishment. So if someone is not able to have a proper amount of nourishment or food, so they will be able to work properly? No. So if they are not able to work 100%, they will not be able to generate the chi. See, if the blood is deficient, spleen won't be get nourished. So if spleen is not nourished enough, so how will it perform its function, and how will it extract food chi from food? So if food chi is not produced, so there will be deficiency of blood again, and there will be deficiency of chi as well. Okay. The other is blood provides a material and dense basis which prevents chi from floating and giving rise to the symptoms of empty heat. So this is what I discussed earlier, that if there is sufficient amount of yin, the yang won't float. Okay, in this case, if the chi is floating, there will be symptoms of empty heat. So in terms of kidney yin, suppose there is a yin deficiency, there will be typical signs of empty heat. It's not the full heat. We discussed it during the yin yang session. So there will be empty heat. Okay, it's the heat due to the deficiency, as blood is unable to hold the chi along with it. So there is a big difference between the symptoms of the full heat and empty heat. We already have discussed. We'll be discussing it later when we go organ by organ. So chi is the commander of blood, and blood is mother of chi. Now we see that the blood and essence relationship. The blood essence mutually affect each other. Each of them can transform into another. The essence plays an important role in the formation of blood. On the other hand, blood continually nourishes and replenishes. So we have already seen this. Now see what kind of pathologies are there with the blood. So there are mainly three. Blood is deficient. So blood can be deficient due to poor diet or wrong diet, imbalanced diet. The other could be the other is the blood heat. Okay. Yeah, and the third is the blood stagnation. So deficiency is definitely by the deficiency of spleen and stomach, and liver and kidney can also be responsible for the blood deficiency. And the blood deficiency manifests primarily in the menstrual function with scanty periods or amenorrhea. Okay. Then we go to blood heat. Now, blood heat, it could be due to the liver heat. Okay, the bloods get heated because liver stores the blood, and if the livers get heated, so liver acts like a container. So its container is hot. Any content we pour in will become hot. So blood will be hot. So what we need to do is cool down the blood and cool down the liver also. So it is one of the reasons. I'm not saying it's the only reason. And as I told, that blood heat can also be the cause of menorrhagia or heavy periods. So heavy periods can have two reasons. The excess is the heat, and the deficiency one is the deficiency in spleen and kidney chi. Many skin diseases like urticaria are due to blood heat. Eczema can also be due. So in order to cool the blood, Li11 and Sp10 are very, very effective points. You need to sedate them. Now coming to blood stasis. So if blood is not moving, it is known as blood stasis, and this is the root cause of all the big names. These you take all kinds of carcinomas, all types of tumors and cancers, and what else? Everything. It can cause pain. It can cause anything. So all kind of big diseases fall under the category of either blood stasis or phlegm. So we need to treat them according to the symptoms. So to move the blood, we use K14, Sp10, and liver 3. Liver 3 is a very, very important point, especially for the emotional. If the cause is emotional, then it's very, very important point. And mostly the chi stagnation is happening due to emotional reasons. Now we'll be discussing body fluids tomorrow. So what I wanted to, what I wanted to teach is, see, all the vital substances are all in one. Just having their different functions at different places, and having different forms, and they all sync with each other. So if something is happening in one part, okay, if something is affected, if one thing is affected, so in long run, that is for sure that some other vital substance will also get affected. It's not like that ophthalmologist will only see the eye problem can only be due to an eye disease. So it is not like that. Okay, so it can be due to liver also, eye disease. It could be due to the spleen also. It could be due to kidney as well. So you have to see the symptoms, and accordingly you have to find out. So there is not a specific cause written there. So as per the cause, we need to treat the patient. So if you would like to ask any questions, you can go ahead.
If anybody would like to ask questions, you can raise your hand. I will unmute you, please. Praveen Chandra.
So the blood stasis protocols you told that we have to stone or sedate.
Pardon, which one?
The blood stasis, LIV3, KL14.
You have to sedate. See, stagnation is always an excess condition.
Okay, thank you, sir.
Okay.
Hello.
Yeah, go ahead.
Hello.
Yeah, please go ahead.
I wanted to know, like, in case of kidney, like for diabetes, what is the this thing? Is the chi stagnated over there, or like what is deficiency is there?
Mostly it is deficiency.
So we
See,
have
chi
to.
stagnation. See, chi stagnation can occur as a result of too much of deficiency of chi. Okay. Suppose if someone just understand this example. See, a very weak person will not be able to move so much. What we'll do, we'll just move to few steps and we'll just sit down. Okay. So if chi is too much deficient, it can stagnate. But as far as diabetes is concerned, mostly and commonly is due to the spleen chi deficiency. Mostly, I'm not saying always.
Okay. Thank you so much.
Hello.
Yeah.
Sir, good evening. Prakash here. Sir, this tinnitus, that means वो कान में थोड़ा आवाज आता है ना, वो उसके लिए क्या रीजन हो सकता है?
Tinnitus.
Yeah, tinnitus.
Yeah, it is known as tinnitus. So it depends on. See, it could be due to deficiency of kidneys. Okay. It could be due to excess of heat as well, like liver yang rising or liver heat. So if it is suddenly it has come, it is mainly due to excess causes are there. But if it is coming gradually in an old age patient and it is coming slowly increasing, so it is mainly due to the deficient causes. We have to find out. Mostly in case of deficiency, it is due to deficient kidneys. We have to tonify the kidneys in such cases, but we still have to see what is the specific cause of it.
We have to tonify the kidney.
Yeah, but if there is a condition attached, see, if it is happening in a over a period of time, see, there are few cases who come and say, I was absolutely fine. Suddenly, I have started feeling some noise in my ears. Okay, my ears are ringing. So that is not due to deficiency. That is primarily due to excess of the energy moving in the ears. Okay, you have to find out whether it's sudden or it's chronic.
It is sometimes it will be there, sometimes it won't be there.
And I have to check it.
Okay, maybe liver or kidney division.
Maybe it depends on the age. I have to see the age of the patient. What other symptoms are present?
Age is around about 58 years.
Still, it's still apart from age. What are the other symptoms? Huh?
Okay.
We have to check. We have to check the tongue pulse. All that.
Okay. Thank you.
Gauri.
Hello. Good evening, doctor. Hello.
Yeah, good evening. Please go ahead.
I have two questions. One is, can we improve or increase the prenatal kidney essence, doctor?
Your voice is breaking up in between. So please repeat it.
Can we increase the prenatal kidney essence?
Can we increase kidney essence?
Yeah.
Yeah, why not? We discussed it yesterday. You should avoid overwork, restrain excessive of sexual activity, have a proper balanced diet, 25 DU4, REN 4, UB23 gives some moxa there, and over a period of time the essence will increase.
Padma.
Why balanced diet? Why balanced diet is required? As I told today itself that a balanced diet will lead to a proper formation of blood. Okay, abundance of blood formation will be there, which will in a long period of time it will getting converted into essence. So this is how you can improve your essence.
Padma Maharir. Padma, Menaka Mani,
Hello, sir.
Yeah.
I am 40 now. I am getting my periods once in 23 days, and it's very scanty and dark brown in color. I am also having less appetite. May I know the reason for this?
Since how many days?
23 for nearly 1 or 2 years. Like this, I am having.
From 1 year.
Yeah. For past 1 or 2 years, I am having this kind of period.
See, now I have to take the whole history here because it could be that menopause is approaching, although it is not the right age. At least it should be at after 45. Earlier it used to be 50, but nowadays it has reduced to 40 years, near about 40 women are getting menopause. So, but it could be due to that reason as well. So I have to check the symptoms, whether it's due to menopause, whether they are menopause symptoms or not, and whether it's due to some other deficiency.
Okay, sir. Thank you.
I think it could be due to deficiency, as your diet is poor. It may be due to that.
Yeah, sir. I am having less appetite.
You have to check your tongue at first.
Okay, sir. Thank you. Thanks a lot.
Tanya,
Yeah. Good evening, sir. Sir, could you please explain the point you using to cool the blood?
Yeah, SP10 and Li11. These are two wonderful points to cool the blood.
Thank you, sir.
Cynthia,
Hello,
Yes.
good evening, doctor. The patient is a 65-year-old man. He had vertigo some 5 years back. Now he again got it after a long gap, and he is feeling heaviness in the head. He has undergone all treatments, all the tests, but all the tests have come, nothing is wrong. But he has very heavy headaches and vertigo problem. What could be the cause?
I would love to have such cases. So please contact me personally. I'll definitely would like to help you. Because without just see, it's not like in allopathy. What we do is, Acha, you are having some vertigo. We'll write some medicine for vertigo. Okay. So in acupuncture, it's like we have to find why it's getting. What is the root cause of it?
Yeah, because always he complains.
If you can please call me personally, I'll definitely help you out.
Your
Are you
number,
comfortable
sir?
with needling or with magnets?
I will have to ask him.
Okay.
Well, so what I would want your number, please.
You can get
his
it
number
from
is
the
in the
group itself.
Yoshis group already. Yesterday I shared. Today
Okay,
also,
madam.
if you want, I will share. Okay.
Okay, madam. Okay,
After
madam.
the session, after the session.
Thank you, doctor. Thank you,
Now
madam.
Fauzia.
Good evening, sir. Hello.
Good evening.
Yes, sir. My son is in 9 years old and he was born underweight baby. But suddenly from this past 1 year, he keep on putting weight and he can't control urine in the night. He's doing bedwetting too. What might be the reason, sir?
So underweight he was, and right now he's 9 years old. Huh?
Yeah, 9 years old and suddenly he's putting on weight.
Can you tell me, was it premature?
No, not
Or
premature.
Not premature.
But he taken that fluid while cesarean
did
baby.
he cried? Did he cried properly?
I think he cried after 5 minutes after doctors tried.
That is the reason. And now what is doing is not able to hold the urine.
In the night time, especially, he's doing bedwetting. And whenever we are traveling, often you need to pass urine.
Okay, just do one thing. Tonify the kidneys. Okay, first of all, tonify the kidneys. Do some moxa. Okay, at G4.
Oh, okay.
I've already or apply some magnets, whatever you are comfortable with. Moxa
Sorry?
has the best results. Whatever you are comfortable with, either Moxa or magnet.
Yeah, I can do both Moxa and needle.
Just go ahead with that, and
Yeah.
tonify kidneys as well. Do you know how to tonify kidneys? Just put K3 and K7 tonify along with GV4, UB23. Just tonify them and do some Moxa.
UB23 and
GV4.
GV4. Okay.
Yeah.
K3, K7, UB23, GV4,
And
right?
do Moxa at CV4 also.
Okay.
First of all, this will help you in urine problem.
Okay.
The problem of overweight, I have to know about his diet. Does he overeat or not? If that is the case, then you have to see the diet.
He eat moderate, but he eat biscuits a lot.
Then just control his diet, na. Then nothing.
Yeah.
The
Sure,
first
sir.
check is diet. If after controlling it, there is no the weight is not increasing, it's absolutely fine.
Yeah, okay, sir, sure. And one doubt, sir, to cool blood, that LU11 and SP10 need to tonify or sedate, sir?
No, it's not LU11, it's LI, large intestine 11, and
Sorry, okay.
spleen 10. And you need to sedate it.
Sedate it, okay, yeah. Thank you, sir.
Abdul Salam.
Good evening, sir. How can we manage ascites, fluid open viscera, in open space of viscera?
How can we manage?
Ascites, fluid.
Arthritis.
No, arthritis. Ascites, fluid inside viscera area, especially in cases of cirrhosis and all, final stage. That when the liver
ascites, you are talking about ascites. Ascites, ascites has a very good results in acupuncture. So as far as ascites is concerned, you need to work on your spleen, okay, and liver both.
Okay.
And let me tell you, if a proper treatment is given, I have treated personally, so fantastic results are there. Within 5 days, I saw 5 kg loss. I was unable to believe that. A lot of fluids got accumulated on the abdomen, and within 5 days, all just move out, and the abdomen size reduced, the liver size reduced to its back to the normal. So the patient saw 5 kg loss in weight. So if done properly, spleen and liver, you need to see these two organs. Okay.
Sir, in case of cirrhosis, can we sedate liver? So already shrinking right now.
Cirrhosis. In case, so if the patient is having cirrhosis.
Yeah.
Are you comfortable with needling?
Needling, okay, sir.
For the best results, the best results, I'll suggest go for needling with master tune points 88, 12, 13 and 14. Just Google it out, find out some videos, put the needle there, and that is the best treatment for such cases.
Sir, points, please repeat. Sorry.
88 master tune points, 88.12, 88.12,
okay, 12,
88.13 and 88.14. These are the best points for this cirrhosis issue.
Okay, sir. Okay, sir. Thank you.
Rekha?
Yes. Hello, sir.
Yeah.
Hello, sir.
Yeah.
ये आँखों के नीचे जो स्वेलिंग्स आ जाती है और हल्के से ऐसे स्किन के बॉल्स आ गए हैं, तो वो किस वजह से होते हैं?
वो जो आपको स्वेलिंग आई है, वो स्वेलिंग आपको डेली आती है और चली जाती है या बनी रहती है?
मॉर्निंग को रहती है।
मॉर्निंग को
उठते हैं तो हल्के से आईज
आपको हैवी लगता होगा।
हाँ,
आपका वेट पुट ऑन हो रहा है क्या?
पफिनेस नहीं,
आपका वेट पुट ऑन हो रहा है? हाँ,
लूज हो रहा है।
थोड़ा सा थायराइड पे देखिएगा। ओके, थोड़ा सा लंग्स को टोनिफाई करिए एंड टेक
लंग्स को टोनिफाई LU9।
हाँ, LU9 कर सकते हैं। LU9 करेंगे और UP13 करिए, GB12 करिए और इतना करिए.
LU9, GB12 and other.
GV governing vessel, UB13.
हाँ.
Okay, do some moxa करिए इस upper back पे. Okay. थोड़ा हीट दीजिए इन पॉइंट्स पे. अपर बैक पे. हाँ जी बिल्कुल, इस पे मोक्सा करिए, बहुत अच्छा रिजल्ट आता है.
LU9, GV12 and third one कौन सा बोला था आपने?
UB13.
ओके.
ये जो हीट के पॉइंट्स हैं इन पे मोक्सा करिए.
ओके, थैंक यू सर.
Good evening, sir.
Good evening.
This is regarding any digestion problem, severe indigestion, depression, and unable to eat food inside my stomach.
Pardon. Severe indigestion, depression and
kind of food stagnation, sir.
Food stagnation, food retention is there.
Yes, sir.
Okay. Yeah. So what is the age of the patient?
46.
Since how many days?
1.5 years, sir.
Pardon? 1 year?
1.5 year.
1.5 year. Is an IT professional or
Yes.
Is an IT professional? Yes, I'm not getting a voice. IT professional?
Yes, sir.
Yes, na? Yes, I have a doubt that he must be having. Yes, sir.
A lot of stress and depression.
I have a doubt that he must be having.
Yes, sir. He has stress and depression and everything.
Yeah, I have a doubt. He must be having some IBS kind of symptoms. I can feel because it's very common in IT professionals. A lot of them come to me.
IBS is also there.
IBS is also there, na. So what you need to do is you need to take care of the spleen and especially the mind. Okay, the heart. For specific points, I need to have proper history, and then only I'll be able to suggest you the right points. Okay.
Okay, sir.
Just by telling you the points in a way, I'll not be able to help you in a proper direction.
Okay, sir. Okay. I'll contact on the charts.
Yeah, sure, definitely.
Thank you, sir.
Thank you.
Menaka.
So, hello.
Hello.
So, I wish to know the acupuncture points and food to meet out deficiency. Just now I asked you about scanty periods, sir.
For deficiency?
Yeah, yes, sir.
I can tell you about the general points, the liver rate. If it's scanty, so scanty has many reasons, but I'll be telling you the very basic points. So you can use SP6, liver rate, and ST36. You can tonify them. UB18, UB20, 21, and you can also use lung 7 on right.
Okay.
And K6 on the left. Okay.
Okay, sir.
Put star magnets there, or if you are needling, just do perpendicular needling.
Sorry?
If you are doing needling, just do perpendicular needling. If you are doing some magnets, just put some star magnets there. Or you can tonify both LU7 and K6 both. But first put LU7 on the right and then put K6 on the left.
Okay, okay, sir.
Okay, these are the general points, sir. Why it's happening, we have to find out the root cause through tongue diagnosis and other symptoms.
Okay, so one more question, sir. I'm also having gum bleeding, sir. To sedate
Gum
the
bleeding?
spleen. Yeah.
So do you have acidity very frequently or burps?
Burps, sir. I'm having burps.
Pardon?
I'm having frequent burps.
Frequent burps, na? Your stomach, the young part of the stomach is getting too much, and that is the cause of the gum bleeding. Okay.
Okay, sir.
So what you need to do is, do you have bad digestion?
Yes, sir. Poor appetite and slow digestion.
You need to tonify. You need to tonify ST36, SP3, okay, and sedate ST21. Stomach 21 sedated.
Okay, sir.
And it's due to the heat. What's happening in your case? It's the yin is getting deficient, which is leading to yang to float. Okay, so yang is getting up, the heat is getting up. The heat is not holded by the yin itself sufficiently, because yin is getting out of the body. You must be having some semi stools or loose stools from quite some time.
Yes, sir. Yes, sir.
So you need to tonify both stomach and spleen, especially spleen.
I have to sedate stomach fire and have to.
No, you just sedate stomach 21. Okay, stomach
sir.
21. You just sedate it, or you can sedate CV13, CV10, stomach 21. You just sedate them, and you tonify SP3, SP6, UB20, 21.
Okay, okay, sir.
Okay.
Okay, sir. Thanks.
Hema, ma'am. Hema.
The session was really good, sir. Sir, actually, my age is 40 and I suffer from rheumatoid arthritis and dryness syndrome. So I would like to know the root cause. What would be the root cause of that? Whether both dryness and rheumatoid arthritis is both related. In some way, I feel like the
Dryness. Rheumatoid arthritis and dryness.
Yes, dryness syndrome.
So you must be having some symptoms of like poor appetite, indigestion.
Yes.
Do you have? Pardon?
Yes, sir. Yes, sir. Almost all the elements got affected.
So
and I'm in severe deficient state.
Mostly what I have found is rheumatoid arthritis is due to deficiency of spleen and lungs. Okay.
Okay.
Okay. So you need to tonify it, and what happens is the dryness is mainly due to, as we discussed today itself, that blood is having the function of moistening the tissues. So when your food chi is not sufficient, so blood is also less. Okay. So if there is a deficiency of blood, there is a dryness as well.
Okay.
Okay.
Okay. Okay,
Sri
sir.
Kripa.
And what would be the points?
Pardon?
What would be the points?
So I'll see.
For that,
It's going to be a dynamic treatment. I'll be starting with the production of food chi first, always.
Okay.
So in order to, first of all, see any disease in the world, or any medicine in the world, whether it's, or any needle in the world, any point in the world, cannot work unless and until you take a proper diet. Okay. If you are not taking a proper diet, blood is not going to form. And if blood is deficient, there is a way long list of different problems. So first, you have to tonify your spleen and stomach first.
Okay.
And then there are a variety of, it's a dynamic treatment. Step by step, the points will change.
Okay. Okay, sir. Okay. Yeah, thanks a lot, sir.
Now chance goes to Sri Kripa.
So thank you for the session. And my question is regarding the food allergies. Like a lot of kids have food allergies these days, like they're really allergic to peanuts and eggs and those kind of things from the childhood, and it never goes. And some of them have very bad skin issues like eczema. And what could be the root cause of those?
Yeah, excess of metal or excess of humidity is, if 5 elements are concerned, or you can say deficiency of lungs and spleen. Mostly spleen is mostly responsible for most kind of allergies, and as far as the rhinitis and all those kinds of stuff is concerned, lungs are responsible for it. So you need to balance both of them.
Is it curable?
Yeah, I have treated personally with cases of psoriasis like hell. We have seen too much of psoriasis, and it took around 6 months. If the patient follows a proper diet, follow a proper lifestyle, along with acupuncture or some sujok or some magnet therapy, definitely there's a wonderful results are there. I have personally treated so many of them.
The food allergies.
But you need to, yes, allergies, definitely you need to stay away from the allergens. See, I treated a case of urticaria. Urticaria is again allergy, a kind of allergy is there. And urticaria is, that patient was having that urticaria from past 20 years, having a very high dose of 40 mg of steroid. Now, beyond that, you can't go. Okay. So, at that time, he came to me when he was having some 40 mg of steroid. Now, that is a huge dose, and the steroid has a lot of n number of side effects. So, it took me around 6 months, and I'm very happy to tell you that it has been around 1.5 or 2 years. There is no itching back, no urticaria is now. And the patient is following a proper lifestyle, and if you have done the treatment correct, it is curable. Why not? Most of the cases, because definitely patient has to adjust accordingly.
Thank you.
Now, Bhanumati.
Hello, sir. My son is having absent seizure for past 5 years.
Pardon? This
And
Caesar, absent Caesars.
yes, sir.
Okay.
He is taking allopathy drugs, and his hair has also got lost. He is getting bald also and obesity also. But now the
That is the
drugs have
result
been
of. Yeah, continue.
but now only increase the dose, and again it is increasing the dose also.
Yeah, so the weight on and the hair loss are the side effect of the drugs which is consuming. Okay, ask your this doctor to just suggest some other drugs. First of all, the other is the cause of seizure is usually the wind. Okay, so you have to see whether it's due to liver iron deficiency, liver blood deficiency, excessive of heat, or whether it's due to kidney iron deficiency. What is the root cause of the wind which is getting generated? So if you are treating at the right time with the right diagnosis, it can be cured. I will not suggest to stop the drug instantly. Just go both the treatment side by side, and gradually your doctor will surely withdraw the drugs if he improves.
Okay, sir. Thank you, sir. Okay.
Satyabhama.
Hello, sir.
Yeah.
Sir, how to treat the scoliosis problem, sir?
Scoliosis.
Yes, sir.
Now, for scoliosis, you have to do acupuncture in a different way.
Is it due to?
Yeah, continue.
So, is it due to deficiency of essence or chi or blood? What's
Yeah,
the root
it
cause?
it can be due to the deficiency of kidneys, the essence, and the liver as well, because both are belonging from the same origin. So we need to treat both of them simultaneously. But only treating liver and kidney would not be sufficient. I have treated many of them, scoliosis patient. You have to really work on the spine. Okay, you know how to needle at spine. You should know in case of scoliosis how to needle, and that is an altogether different procedure. You won't be, even I was shocked to see that 85-year-old patient came to me with a bent spine, severe, and we got the result within 1.5 months. Another case is still with me, and that is basically not of scoliosis, kyphosis. So that result we got within a week. So I was also amazed to see that we got results within a week as well. So you should know, not only you have to needle the organs, but along with that you have to treat the local area. Okay, so I'll suggest in such typical cases, acupuncture has always the upper hand. That is the best treatment for these kinds of cases.
So treating with local points and tonifying liver and kidney will give results, sir.
Yeah, but local points, how to needle them, that is a very tricky thing. Okay, that is very important, how you are needling and where you are needling. That is
so
very
in which direction we should needle it, sir?
I always needle perpendicular.
Perpendicular.
Yeah, but the location is very important. See, it's not only the perpendicular needling you are doing. I don't tonify or sedate. Okay, I don't tonify or sedate in such cases. I do a proper needling. I create a surgical kind of impact. I try to create that kind of impact with the local points. And along with that, you have to provide some stimulation as well. That gives quick results.
Okay, sir. Electric stimulation so can be given, sir?
Yeah, you have to give. Otherwise, there will be so many of needles. You'll be doing it stimulating from your manual stimulation. Will be too much tiring. You have to use some electric stimulation. But it is curable. It is definitely, we have got results.
So electric stimulation with connecting UB11 and UB23 and DU14 to DU4, will it help, sir?
Yes, definitely. It can help. These are the points which you must take. UB11 is another one which you must take.
Okay. So the frequency of treatment, sir, weekly 3 days like that? Can we give like that?
Now, initially, I prefer to call daily. Initially, if we need to get quick results, I believe in getting quick results, so I call them daily, and after that, accordingly, we can just increase the time gap.
Okay. So, but this is curable, sir. It will give result.
I have cured. I have my own ways of doing it, and I have got results. So yes, it is curable.
Okay. Is 54 years old, sir?
I have treated 85 years of age, so I'm very sure 54 is treated. Can be treated.
Next guest goes to Shasin.
Okay. Sir, I wanted to ask about the kidney stones, sir. Reoccurrence of kidney stones.
Okay.
Again and again, once removed, again it's coming.
Yeah. You can go and check my video on YouTube. I have one of those videos, and let me share that story with you. So this patient was undergone 2 times. Okay, and this was like his kidneys were like full of stones. Only stones were there. I don't know how urine was getting formed. Only stones were there every day. I use different points. I don't use these traditional points. I use different points altogether for removing the stones from kidney and bladder. Okay, so that is out of the scope of this topic which we discussed. So that patient was full of stones. So every day, 2-3 stones were used to get out. Now it took me around 1.5 months, and successfully we got around 15 mm of stone, the biggest one, without pain. So this was one part of the treatment, that the stone should get out. The other part of the treatment was, see, the question which you just asked is, the other part of the treatment was the factory of stone should be stopped. So what is the root cause of it? So the root cause of it is the phlegm. Okay. So do you know how the stones are formed in, whether it's gallbladder or it's kidneys? So the main cause of stone formation, it could be due to excess of calcium, definitely, or excess of minerals. But nowadays everyone has ROs and at their home. So how still it's happening? So it's mainly due to the formation of phlegm in the kidneys, in the body, or in the gallbladder. Okay, the root cause is the similar. So cause of phlegm is always the deficiency of spleen. And now why spleen is getting deficient, you have to find out whether it's deficient due to poor diet or some other organ is affecting the functioning of, like liver usually does this. So it suppresses and attacks the spleen. You have to really find out and figure out what is the root cause. So once you have got the root cause, treat it. And I think it has been over 1.5 or 2 years. The patient hasn't turned
It's
to
been
be
20 years for him, sir. He has
so
tried many-
just tonify the spleen, just work on the spleen, just stop the formation of phlegm, and I'm telling you, he'll be fine.
SP6, sir.
SP6, SP3, UB20, 21, SP40. These are the basic points. CB12, digestion must be hampered. If it's happening from so long time, there must be some severe indigestion. Otherwise, it can't happen. I'm having I'm having a patient just 19 years of age, and he is having stone. Okay, nobody else in the house is having stone. Now, what is the root cause? The root cause is the formation of dampness or formation of phlegm in the body, and the symptoms of the patient are that he feels very lethargic, and he is very he always try to sleep. He can't. He is unable to concentrate on the studies. So still, I found the root cause. The root cause was deficient fire in the body. So I tonified the fire, and everything improved. So as soon as we tonified the fire, I improved the spleen yang. Okay, you have to tonify the spleen yang, the Ming Men or the fire of gate of life. Along with, you have to tonify the heart and spleen, and I got the results. So in every patient, the root cause will be different, but there is certainly going to be some formation of phlegm. Okay, you have to treat the phlegm first, and it takes some time. Phlegm is difficult. The most difficult thing to treat is phlegm. Have some patience, and you will get the results.
Okay, thank you, sir. Thank you.
Okay.
Is
Thank
there
you,
any
doctor.
food to be avoided, sir?
Any food?
Yeah, to be avoided.
Yeah. I'll definitely start with the dairy products. That just avoid them.
Okay.
Yeah, and if the spleen is deficient, which looks like the case, add some a little bit of spices, a bitter food. That would be a better thing to add. A pungent food or a bitter food, spicy, a bit of spice, not too much. Otherwise, acidity will be found because of the poor indigestion. So a very slight amount of I used to do is I add a the mirch pickle, the spice pickle, red spice pickle, which is not too spicy. Okay, a slight amount.
Okay, sir. Thank you. Thanks a lot.
Okay.
Thank you very much, doctor. With this, we can wind up the session for the day, and we will continue the session by tomorrow at 8 p.m. Those who need a personal consultation with the doctor, you can get the number from Joshi's Kerala group. Thank you, all participants. Good night, all. Thank you. We will meet tomorrow.
So